Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rankus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you, everything from nutrition and mental health to alternative therapies and natural living.
We'll bring you the expert interviews, insightful discussions, and practical tips to make motherhood a little easier and help your family thrive.
Please keep in mind that this podcast is for informational and educational purposes only and is not intended to replace the advice, diagnosis, or treatment plans you have with your personal healthcare team. Please have a conversation with your trusted healthcare provider prior to making any changes or implementing any strategies or advice you learn from this podcast.
Whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Here at the Motherhood Alliance podcast, we challenge the status quo, ask the tough questions, and offer a supportive community for moms who want to make an informed, holistic choice.
Thank you for joining us on this journey.
Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a new 4-episode series with Betsy Wischer, a board-certified nurse practitioner who is doing some really important and cool things in women's health in Northeast Wisconsin. Betsy has a background in labor, delivery, and the NICU, and now owns WishLane, where she focuses on supporting women through everything from hormone shifts to pelvic floor concerns, especially during perimenopause and menopause. What we love about Betsy is that she doesn't dismiss symptoms, minimize concerns, or tell someone that their symptoms or discomforts are just normal aging and that they have to live with it. If something feels off, she takes it seriously. Outside the clinic, Betsy is a mom of 2, she's married to her middle school sweetheart, and she loves unplugging through hunting, reading, crafting, building Legos, and more. We're excited for you to learn from Betsy. She is so fun, and you're going to love her in these episodes. Let's get started. Hello, everyone. Welcome back. We are in episode 3 with Betsy from WishLane. Welcome back.
Thank you.
We've had some great conversations. I'm enjoying this series. I mean, we're in a 4-part series total with you, but 3 of them are committed to perimenopause and helping these women really feel more empowered. 4th episode, next episode is going to be for our guys with andropause. But in this one, we're going to be talking about solutions. So first episode and second, we talked a lot about what women are experiencing and just kind of opening up the conversation and making things, it can be common. It can be common for a lot of things that people are experiencing, but a lot of people are suffering in silence. So I appreciate that you have such a passion for making sure that people do not just dismiss their symptoms and that knowing that they have solutions. So let's jump into that today. What are some solutions that can help with a lot of these common perimenopause symptoms? What do you guys offer in your office, as well as what would someone experience in like an OB office?
So if you go traditional medicine and see your PCP or OBGYN, most of the time they're limited of doing estrogen and progesterone. So those are helpful, but they're never going to do the testosterone piece that women also need. And I think that's just the way medicine is, that it assumes testosterone is a male hormone. It doesn't seem to be associated with women so much.
They're obviously very educated, but I wonder if they really have an understanding of how to use a lot of these hormones.
And that's just it. Like, they can do the lab work, but then they don't necessarily know what to do with it.
Yes.
Because that is not what their training was. So, and they don't offer like hormone replacement therapy because it's not FDA approved or cleared. So they're hindered on what they can offer based on what their healthcare system is going to allow them to do.
So if they're not offering hormone replacement therapy, what are they offering?
Antidepressants.
Oh.
Birth control.
Okay.
Sometimes gabapentin, which is a nerve medication. So like if somebody has nerve pain or fibromyalgia, it's a very common one that gets... But it's just blunting it. It's not fixing anything. It's covering the symptoms.
Yes. Or covering symptoms, not fixing the deep root.
It's a script for that side effect, for that, symptom, and then we just kind of keep adding to it. I've had clients that had that they had a laundry list, or their doctor said, like, you should not be doing hormone therapy. And I'm like, okay, well, it's not like we don't do a thorough health exam. I know their health history. I know their lab work. I did it. So now you're fear-mongering and spreading misinformation and making them terrified that they're going to die from X, Y, and Z because of doing this intervention, but they've never felt better in their life.
Yeah.
Can we sit on the birth control piece for a second? Because that is technically hormones, isn't it? I don't remember. What is birth control made from?
So you have a couple options. Some are just progesterone and some are a combo of estrogen and progesterone. Time and place, I have a love-hate with birth control. I think it serves a great purpose, but we also have to remember what it's doing to our women long term.
Yeah.
So one of the top 3 killers of women or dangers, that osteoporosis. Every woman knows it. And how many times did it get drilled into you? Fall, break a hip, die.
Yeah.
Because we don't recover. Women don't reach peak bone density because we've been put on birth control so young. It changes the cascade of building bone. And so then you stall out and you just kind of max out wherever that bone density was at when you started birth control. Then you go through perimenopause, menopause, we come off the birth control. But now because we lost estrogen, we're breaking down bone density. Well, now we're breaking down from a subpar level. We're going to get osteoporosis.
Yeah.
So sure, birth control has great benefits for some people, especially like your PCOS patients. If they have endometriosis, yes. But let's not forget what the possible potential damage is with it too. And we all know safety profile, stroke, heart attack, death.
Yeah.
Because estrogen increases that risk. Fun fact, does not increase that risk when it is a cream, pellet, or patch. Because it is not metabolized by the liver the same way as oral estrogen. So that's a big one, because I get that from providers a lot too. They said, "Oh my gosh, but I could have a stroke. I could have a blood clot." I'm like, it's not metabolized the same way. Oral estrogen literally increases clotting factors in the liver, decreases anti-clotting factors. So it sets you up for that perfect scenario. If it's a pellet, patch, or cream, it does not.
Yeah.
And then these are also considered synthetic, right? Because there's bioidentical hormone replacement therapy.
Yes.
But birth control is going to be lab created hormones.
Correct.
And
Yep.
so when you're taking, let's just say it's the pill. So you're taking a pill every single day, and that's keeping your hormone levels at the level that the pill pack is made to do, right? But it's lab made.
Yes.
Okay.
So how you metabolize and break that down, everybody's different. That's why you also might have to try different birth controls, because you might not feel great on one, because how is it made? The bioidentical, there's a lot of different ways of how they do it. Most common is plant-based. So it is as close to your own hormones as possible, and they change one molecular compound on that estradiol so that it is similar to you. So you're going to absorb it and utilize it better, because it's as close to yours as natural as possible.
Right. Well, and like we're talking about here, there's other options. If you're thinking that you want to take it for hormone-related issues or whatever, there's other options other than birth control for sure.
Yes.
And like you said, you have a love-hate relationship with it. So
because it's time and place. Sometimes it's great, sometimes it's not. And hormone therapy also, you can do creams, you can do injectables, you can do pellets. There's so many different forms, so you have options. A lot of women like the pellets because you do it once every 3 months. We're busy. So having something that I don't have to think about too often, great.
When you say pellet, what do you mean? Like a swallowable?
So they look like little Tic Tacs, and we implant them in the fat pad of your butt cheek or your hip, your flank area, which also sounds scary, but it's not. You numb it, you don't even feel it, a little tender sore for a couple days afterwards, done. But then you slowly metabolize it and release it, so you don't have to keep doing something to get your levels up. It's there. You'll break it down over time. Injectables, for most women, it's twice a week that you have to do the injection, sometimes 3. We want to hone in on where you feel good. Creams are every day. So those tend to be the less chosen option because, again, women are busy.
yeah.
And what if you didn't put it on right? What if some of it transferred to your clothing? What if it didn't get rubbed in right? You also have to make sure you're washing your hands really good, cleaning out your sink really good, because that's hormone. So if you have a little kid at home,
gets transferred to your spouse.
Yes. So you want to make sure you're super diligent about how you're applying it and cleaning up after. Well, that adds to the mental load of being a woman.
Yeah, another thing.
It usually gets nixed pretty quick.
Yeah.
Okay, so right now we're talking about the options for bioidentical hormone replacement therapy. But a question here is if, naturally our bodies are taking us from regular cycles to menopause when we are done having kids and no longer get cycles, right?
Yep.
And then so our hormones are fluctuating in the middle as our body's just figuring it out. If you're doing hormone replacement therapy, how do we end up getting to the point where we no longer have our periods, but also are not having crazy symptoms?
So we basically make your body think that it is pre-perimenopause. So back to your 20s and 30s where you feel good, things were firing off, and you were just at max performance. Then we make sure too that we're giving you progesterone, because that is going to tell your uterus hey, we don't need to have cycles. Shut it down. So my body thinks I need to have cycles, but I don't need my uterus thinking that I need cycles.
Okay.
Give you that progesterone. And we've come to find out too, even if you've had a hysterectomy, we'll put you on progesterone because it helps with mood stability and your sleep. So most women aren't sleeping good. And when I tell them, hey, I got something for you that's going to help you with sleep, and it's your hormones, because that's what you used to have. That's why you used to sleep good. I'm not giving you something synthetic. I'm not giving you another script. You're just going to take some hormones at nighttime and you're going to sleep really good. But it's also going to make sure that we don't have cycles anymore. If somebody does start to have cycles, then it's okay. We reevaluate. We might need you to go to OBGYN to get evaluated because maybe you have polyps or fibroids or endometriosis. Something's not doing what it's supposed to. Let's make sure we get that eval'd. So it's making sure your provider that's doing hormone therapy and offering it to you is doing their due diligence to make sure that if something does go, not a miss or awry, but not maybe as expected, there's follow-up care. There's a plan there of what we need to check and intervene with to make sure that there's nothing wrong.
Right. Is this like, if somebody goes on, if they're in perimenopause, heading into menopause, and they get on bioidentical hormones, how long would they stay on it, ideally for a long time?
Indefinitely.
Yeah.
Because your body, if you can stop. So I want to make sure, some people decide like, hey, it's not for me, whatever, and they want to stop.
Or like, I just want to be done.
Yeah, totally fine. Your body will go through a period where you kind of hit the low and kind of wash everything out, but then you're just going to go back then to where you would have been if you'd never done an intervention. Now, that's still going to be suboptimal hormone levels. That's why you sought help in the first place. So you're just going to go back to where you were.
Right.
No long-term side effects, complications. There's no issue.
Okay.
But you're probably not going to want to because of how you feel. You don't realize how crummy it is and how hard you're struggling until you're on the other side of that. And you feel good and function again.
Well, it's just like looking back in your 20s when you were, like you said, like just ready to go. Your brain is great. You don't realize how good it is until later when you're like, I had it great back then.
Well,
and
it's
I didn't even
that
realize.
slow transition of that perimenopause, since it can take years and it's not just all symptoms at once. It's like this slow progression. So again, you don't realize that your memory's not quite as sharp as it used to be, or that you're not sleeping as good, or that you're more anxious or more tired or whatever. All those symptoms kind of just slowly creep in and then they slowly get worse. So you start to lose perspective of what it was before.
What percentage of women do you feel like could or should be on hormone replacement therapy? And the reason I ask is, I can't remember if this was in an episode or if it was off the mic, but Dre and I were talking about our mom's experience, because oftentimes, like you had mentioned, your experience may be similar to your mother's. Mm-hmm. Is that true?
Yes.
So, and our mom, we could ask more deeper questions, but we were asking her, like, how was menopause for you? And she's like, it was fine.
I asked her, because she's like, I don't know. I just stopped. I'm like, you just didn't realize symptoms, something,
awfulness,
no,
crankiness.
She's just one of those people who was like, a deal.
And I think it comes from the generation when, like, if you didn't talk about it, you didn't put too much weight on it. So you didn't spend time thinking about it. So, like, how bad was it? I don't know, because I didn't have another option or outlet to voice it. So I just had to keep it to myself and keep functioning.
Or like you said, like the symptoms just kind of like you go from super high up and then it just kind of like
peters out.
It just peters out and it's just what it is. You
know?
I'll
hear that from a lot of providers, or after they've talked to their provider, that's like, well, that's just aging. That's normal. Right. And so now they got gaslit into thinking that this is just what the next 30, 40 years is going to be like. And there's no choice.
But I guess it's like each person genetically is different. And so like what percentage of people, maybe they hit a couple of little bumps, but they're like, overall, it was fine. Like, I didn't need hormone replacements. I'm in my 60s and 70s now, and I feel great. Versus what percentage of people that like really should like mentally expect.
I would say like a reasonable, if I was just to pick a statistic, probably like 80% would benefit.
Yeah.
And I think that number is increasing just because we know how much more can be done, but also our life expectancy is longer. If it's where a lot of this came from, is like it was a shorter life expectancy. So then our hormones shifted to compensate for, hey, you're caveman, and guess what? You don't bear children anymore, so you're going to get the scraps because we need to give it to children and women of bearing children. So that means everything you eat, we need to store because we don't know where the next thing's coming from. So that's why all women, it's that tire right around the belly. You could be in a calorie deficit, you can work out more, and you're still going to gain weight right there. Because without hormones, that metabolic pathway has shut off and your body literally doesn't know what else to do with it. So now that we're living longer, we're seeing that outcome longer and the side effects more. Let's do something about it. Yeah. And there's the option for it. So I think some women transition, no problem. Awesome. We also give women the choice of, like, I have quite a few clients, they want to start off slow. They don't want to throw everything in the kitchen sink at it. Totally fine. So let's optimize your levels of vitamin D, B12,
Yeah, let's start with
iron.
the basics, the foundation.
Yes, let's make sure you have those things to metabolically even be able to do anything with your hormones. And then a lot of women, thyroid. So many women get misdiagnosed with hypothyroidism, subclinical hypothyroid, so the lab looks fine, but you have all the symptoms of it, or Hashimoto's. So your thyroid has inflammation and is not functioning optimally. We know as we age, our thyroid doesn't function as it used to. That's normal. Okay, fine. So we need to supplement, help it out here and there. Can you do that naturally? Yes. Can you also get a prescription for it? Yes. So you have options. But if that's fixed, so like, okay, great, we'll start with those supplements. Then we'll start with optimizing the thyroid. Then we're going to reevaluate in a couple months. And then it's, what symptoms do we have left? What's not quite firing, or what's still giving you a hard time day to day? Then it's, do I think hormones are going to fix that?
Right.
Most of the time, yes. So then it's, okay, we've now optimized everything else. We went slow and steady. You're still having issues. They're better, but not ideal. Give me one chance.
Yeah, try this.
Give me one round of hormones. If you hate it, you walk, no big deal. But I'm going to tell you that there's such a high rate of success with pellets or hormone therapy in general that it usually only takes one round. And then you start feeling better.
And they're like, I'm a believer.
Yeah.
Let's do it.
Very small percentage needs that second round. And that's usually if you've been further into menopause, because now it's like those hormones have been gone for so long. You got to give it time to fire back up.
Oh.
And I'll describe it like Shannon uses taxis. I use the assembly line. Like, okay, you got an assembly line. You had all these hormones coming down the pipeline. You had a bunch of workers. Well, then hormones stopped. We laid everybody off. So we just have a couple guys working. Well, now I'm going to give it all back to you. I still only have those couple guys.
Oh, yeah.
So it's going to take some time for your body to adjust to that, to actually know what to do with those hormones again, because it hasn't had them. So give it time. Very low side effects for all of them, like whether that you're doing creams, pellets, injectables, a little bit of water weight. So I always like to warn women because we all care about that number on the scale. Testosterone makes sure your muscles swell, pulls water in. It's normal. It's okay. It's not going to keep happening. Some facial hair. And when I say facial hair, it's not you're growing a beard, not turning you into a man. It's like the peach fuzz,
Sure.
which most of us already have and don't care about.
Right.
Possibly some acne. Not long-term either. It's the initial, because if you figure your hormones were in the basement, I pulled them out. I'm not letting them drop back down there again. But in that transition period, there's a lot of things trying to figure out what's happening.
That makes sense.
So you just got to give it time. Trust the process. Give your provider the benefit of the doubt to give time and figure out exactly what they need for you. Because it's not cookie cutter, and it shouldn't be.
That's a lot. It's a lot to think
so
about
good.
because, I think it's, this is a really silly example, but it's like, I'm getting some gray hairs and I'm like, I'm going to hold off on starting to dyeing my hair because it's going to be a forever thing or until I want to be done with it.
Right.
Kind of thing. And so I feel like the mentality for me, at least, is kind of similar to that of like, well, I don't want to have to do things outside of the natural realm, like in my home, I should say, until I really feel like I have to. So I really appreciate you walking through those steps of kind of like, well, here's kind of the first step is we're going to look at your basic nutrients level and then this and this and this and this.
Well, and if they don't talk about like the perimenopause, there's more studies, more data coming out. If we start estrogen therapy during perimenopause, I actually help your heart health.
Oh.
Estrogen can be cardiac protective. So waiting until you're finally ready to commit, totally fine. Just knowing that if you start earlier, there's no negative and you might have some additional benefits of protecting some other organ systems and menopause won't be as rough. That we kind of buffer that and make that transition easier.
Very interesting.
That is, and I feel like it's super good to know too. Like if you start it and you stop it, or, like there's nothing that's going to be bad that happens.
Yeah. You're just going to go back to how you were feeling. And I think, again, being more transparent about like, okay, I'm 34 and I do hormones. So I had a hysterectomy. That's not why I do hormones. I do hormones because of all the things like not sleeping good and, sexual health, all of it. But that there is no set age because everybody always thinks that they have to wait until after menopause.
Yeah.
And I'm like, you don't have to. You can start at any time. I mean, even if we have, say teenagers, young females, that if they have PCOS and endometriosis and they're already having hormone issues, it's like, okay, well, let's check it out.
Yeah.
Because it's not that you just have to suffer and struggle with it then until later. Like, let's see what we can optimize.
How young patients do you see?
So since I'm family practice, I can see children.
So you can see children.
I can see birth to death. I can cover the whole gamut.
Okay.
So there are some things that I will do because having that scope, it's usually not hormone based, but
yeah,
a lot of times it's supplement based. Like, hey, you got a kid that's got some gut issues or the acne, and they're just kind of figuring out like what's going on. But I can take the time to do that then.
Okay, I do want to make sure we have time in this episode to talk about your EmpowerRF platform, though, too. So I've seen this on your website. You've mentioned it, but I don't know anything about it. What is this?
I love it.
Oh, okay.
It is, I think we're one of the few in the state that even have the platform, but that it can do the same results of a bladder slinger mesh without surgery or downtime, same results of a labiaplasty without surgery or downtime. So there's 3 different applicators that we have on
pause. What are those things that you mentioned? I'm aware because we have some background in this, but a lot of people don't even know what you were just talking about.
So when we have that stress incontinence or urge incontinence and we're just leaking and dribbling, there's a test you can do with urology to see if you have like pelvic floor dysfunction. And if it cannot be fixed with PT, we can put in a bladder sling, which is just like a mesh hammock is like, I guess the best way to describe it, to support that bladder so you're not having that dribbling. There are a good amount of complications that come with that. Mesh can integrate with tissue. It can be really hard to get out if there's a problem. So you're kind of stuck with it. And then labiaplasty is cosmetic that or functional that if there's tissue laxity with labial tissue, they can remove some of that and kind of nip and tuck so that it's like coiffed. Put things back where they were so that intercourse isn't difficult, it's not painful, or we don't have skin irritation.
Okay, thanks for the definition. So now back to the EmpowerRF platform. How does this do this?
Yeah.
So one of the hand pieces does microneedling with radio frequency. So that's heat based. Everybody always flinches at that one because they're like, "You're gonna what now?"
Right. Yeah. What needle?
You said
what?
needle. I don't know what you just said, but there was a needle word in there.
So just like microneedling your face, you microneedle internal, so the vaginal canal and the outer tissue. That area is so highly absorbent that put on some topical numbing, you don't feel anything. And then background labor and delivery, like I know that anatomy like the back of my hand. So I am a big pusher of, I think that people that are using this device should have a really solid
for sure
OB background or labor and delivery. Just, you got to know that anatomy. You absorb that numbing so well, you don't feel anything. And then when I'm applying it, I'm also doing an internal exam to make sure that there's nothing surprising or unknown that you didn't know, because let's be real, not everybody wants to go to their primary or their annual PAPs and stuff. So let's just make sure we're doing good healthcare and clearance and assessment. That numbing sits on for half an hour, you don't feel anything after that. That microneedling is going to stimulate collagen. It's going to tighten the tissue, make it healthier, regenerate it, and increase blood flow. So that whole system is going to function better. And if somebody has pelvic floor issues, I can make sure I focus certain treatment areas to then build up the collagen there to support the bladder, so that it's just like that bladder sling. You now no longer have the incontinence issue. Usually you'll notice within the first week after treatment.
Oh, wow. And how many treatments are generally are there?
Usually a package of 3. And then I do tell clients, like, you got to do some maintenance because just like aging, you're going to lose collagen everywhere. So you will lose that collagen that we built up. So either doing that treatment once a year or the lesser invasive ones a couple times a year just to maintain that healthy biome. So there's the microneedling one, then there's another one that's just radio frequency. So it's just heat. And it's a wand, and it's going in and out and making sure that I get the temperature to that set temp that increases neocollagenesis or collagen creation and increased blood flow, and keeping the tissue at that heat for a certain amount of time. It's going to get you the same result as the other one, just more repetition would be needed.
Okay.
And then the last one's Kegels on steroids. So it's a little applicator, put it into the vagina, and there's electrodes on the front and back. That's going to, it's kind of like a TENS unit. It's going to force your pelvic floor to do those Kegels. Halfway through the treatment, I turn it. So now we're getting front, back, left, right. We are getting a full 360 of doing those Kegels. Yeah. Every treatment, I increase intensity and increase duration. So now we're working on strength and endurance.
Who is this for?
Yeah.
Everyone.
Okay, but
I'm not going to lie. I'm very curious. It sounds like great for everybody.
I guess when I asked that question, we talked in a prior episode about we are big fans of pelvic PT. So like, is this something that you would do with PT at the same time if you're experiencing leaking or pain with intercourse or laxity or any of these other symptoms that we've talked about? Is this kind of like a solution that should help take care of all of it? Should this be combined with PT? Like, how does that work?
I love it with PT just because, like we were talking off mic, that like not everybody knows where that pelvic floor is and how to properly engage it. So if we do one of the treatments that stimulates that, so then you know what it feels like, you can probably do even better physical therapy then, because you can engage the right muscles while you're there. Some people do physical therapy and it still doesn't resolve their issue completely. So, okay, great. It's not it sucks for you and that's just the end game now. There's things you can do in addition. So it can be on its own, in conjunction, afterwards. They complement each other. They go hand in hand really well, but also don't have to do them together if somebody doesn't want to.
Wow, this is really interesting. Might have to come try it.
I know. I'm just like super like, I feel like this would be very beneficial.
Well, that's the hard thing is nobody talks about it.
Yeah.
It's really hard for me to advertise. I can't be posting before and after photos. I'd be kicked off of social media so fast. I think I'm funny and will post like tacos and roast beef sandwiches or scrunchies.
Gosh.
So I'm like, I just need to get your attention to know like that's an option.
Yeah.
Because people don't. And the only reason I knew about it was my mom had a hysterectomy in her 50s through a blood clot, so then nobody would give her hormones. She did one of the only treatments that's really known besides what we do is called the Mona Lisa. And it's a CO2 laser. So it ablates the internal vaginal tissue, but like resetting that biome, which in theory makes sense. Your face all is giving way. It's painful. It's not
It doesn't
fun.
sound, yeah.
It's not. And it's uncontrolled. So there's a lot of complications that get reported with it because I can't see in there what I'm doing. Her recovery, like I remember driving her home on an ice pack. She needed a Valium before the appointment. Like it was rough. And then to do a series and then be told, okay, now you're going to have to do them intermittently to maintain.
What?
So she did her 3.
Yeah.
Paid out of pocket. She's like, I ain't freaking going back. Are you kidding me? Like that was horrible. I did my 3 and that's it. If this is my life, I'm done. I'm not going to keep doing it.
Yeah.
We were at a conference. I saw this and there was an OB showing before and afters and talking. And I'm like, this is fantastic. You have an option that's pain-free. For most, I will say there are some if you have scar tissue from an episiotomy or a tear, like might be some areas, but I test it all. So I know where those areas are and try to make it as comfortable as possible. But you're telling me I can give a non-surgical intervention that's going to deliver top-notch results and actually like fix the problem.
Yeah.
I got to have it.
Right.
Like women need it.
Yeah.
And then you hit that crux of like, how do you talk about it? How do you get people to know about it?
Yeah.
Because I think there's only like 5 clinics in the state that have it right now. So I know a lot of patients that are like driving to Chicago and stuff because they're down in Milwaukee, it's closer and nobody else offers it, or they only offer the CO2.
Right.
So it's like they don't even know what your options are. And there's so many options. Even treating things that you wouldn't have even thought of. So with the radiofrequency one, it can also help with hemorrhoids. It can also help with lichen sclerosis. So that's when that tissue literally seals to itself. So it's dysfunctional cells. Or if you have chronic UTIs, bacterial vaginosis, yeast infections, because that heat will reset the biome. So you don't have to keep having the chronic issues. And I treat external too. So treating that space of tissue between like urethra and vaginal opening, that is heavily estrogen based. So it gets extremely painful when it starts lacking hormones. So if we increase circulation and get it healthier again, how many women get put on antibiotic for a UTI and they don't have one? Because they have symptoms of a UTI.
Right, yeah.
But it's just that tissue is inflamed and irritated and ticked off.
Oh, man.
This is kind of different, but can you utilize this device at all for breast tissue when it comes to, I just think about, estrogen and like breast can have a lot of different
receptors.
Yeah.
What end goal do you want it for the breast tissue?
Well, I was just curious because I did a thermography scan recently.
Yeah.
And so we were talking about how estrogen, high levels of estrogen sitting in the breast. So if you're not like doing lymphatic massage and drainage and things like that, other things that you can do. But if you have a high level of estrogen, it's more apt to be a environment that cancer could grow in. And so it was just, as you're talking about this, I'm like, is there any opportunity for the breast area?
I don't see why not. Have I done it? No. Is there research on it?
Okay, well, I'm going to check back with you.
Because now I'm like, I'm usually the one that's like, you know what, let's test it. Because like in theory, if it all fits and makes sense and is logical, like,
right.
Heck,
like,
why not?
Right. And like you said, tissue is tissue, whether it's vaginal or anywhere else. Like collagen is everywhere.
Yes.
Estrogen goes everywhere. So why not? Yeah.
Makes sense. You could just do it. It'd be almost like a heated lymphatic massage.
Yeah. Okay. Well,
I'll let you test it out.
Dummy.
Yeah. Come on in.
Okay. This sounds awesome. This was super informative. I've really enjoyed these episodes, and we do have one more coming up. We're going to be shifting focus into guys, kind of like the male menopause, andropause. What are they going through as they age? How are their hormones changing? Erectile dysfunction, other things that guys might be experiencing, and maybe should just have a heads up on and know what their choices are. So we got one more episode coming up with Betsy. We can't wait to meet you guys in the next one. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.